right, everyone. Welcome back to another episode of Thinking Critically. I, again, have Patrick Maloney on because of what's going on with the COVID-19 epidemic. But instead of just referring to him as Patrick this time around, he is now a freshly minted doctor. He is a Dr. Maloney. Anyway, Dr. Maloney, thank you so much for joining us. I really appreciate having you back with us.
Oh, thanks for having me.
Yeah, absolutely. Absolutely. So how does it feel to be a freshly minted doctor? Because you're not even a week out, right?
No, not even a week out. It doesn't feel that different, to be all that honest with you. So I was the first person in LSU history to present their dissertation defense online. And it's kind of tough, to be honest with you, because you're not there, you're not sharing things with your family, with your friends, you're not socializing afterwards. The coronavirus pandemic has sort of affected all aspects of society, and that includes dissertation defenses. But overall, the dissertation defense went really well. And I really don't know what to say even. It's still surreal. It still hasn't sunk in yet that I am actually, done. And now I'm just applying to, various jobs and actually have to do revisions on my dissertation, as everybody does when they submit them. So
Absolutely.
I'm working on those as well.
Okay.
Yeah, but it should be all officially submitted this upcoming Monday. Yeah.
So the revision requests weren't substantial. Nothing too big.
No, nothing too huge. Everything was pretty much in order. So our dissertation is structured in a 3-paper format. So that means that by the end of your dissertation, you should have 3 papers that you can go ahead and you can publish in journals. So you're publication ready. And they do that so you can cover a wider array of topics and you can get more publications under your belt. And my first 2 papers were really good. And my 3rd paper just had a little bit of revision that needed to be done. But I did notice that I had Natalie's waving me off, about it. Natalie's my wife. She's telling me not to tell you this, but I had a coding error in my first paper. So I had to go back and revise that. So didn't change my results all that significantly, but even the best of us, even those of us who call ourselves doctors, make those pretty substantial coding errors.
Well, nobody's perfect, right? Nobody's perfect, and we all make errors.
Mistakes.
And when you recognize those mistakes, it's important that you rectify it, though, instead of just
Absolutely.
letting it. Yeah, you got to go back and fix it for sure.
I wasn't just gonna let the paper go to publication. So the person who was helping me with it, because we had to without getting overly technical, we had to do some additional components of the analysis. And then we realized that the components of the analysis that we were trying to conduct were built on, sort of faulty assumptions. And she said, well, things can go to print with there being errors, but we've got to deal with it down the line. And I was like, I am not submitting my dissertation with errors in it. It will be done. It will be revised. Yeah.
So was that something that was a colleague caught that mistake? It wasn't something that you, it went off to the referees and then one of the reviewers found that there was some sort of error in the coding?
Well, yeah. So it was one of my dissertation committee members. So when you're doing a PhD, you typically have around 5 people that sit on your committee and they provide guidance throughout the whole process. And then at the culmination of the process, either accept or reject your dissertation. So she was the one who I was working with on this one aspect of the paper. We caught the error, but somewhat embarrassingly, it's already been submitted to the journal. So I'm going to have to correct the error when I get the revisions back.
Well, these things happen.
It won't be that at the end of the world. It wouldn't be the first time somebody's made an analytical error in a journal. Prior to it going to publication. Obviously, you want to catch it before you publish those results.
Yeah, absolutely. Yeah. You don't want to be putting wrong results out into the scientific sphere.
Absolutely.
For then people to draw wrong conclusions from. No, yeah, I mean, that's just, for those tuning in, that's just a part of the scientific process, right? You make mistakes and you correct them. And then when it comes to science over the years, new science or old science is then replaced with even better science. So you're building on old results, and it's just this cumulative process of the scientific method. It's just kind of how it's done.
Yeah, absolutely. Shifting paradigms over time is how we advance as a scientific community.
Yeah, absolutely. Absolutely. So that's super interesting. So doing the final revisions, you'll be submitting those on Monday. And then what's the next step after this? So postdoc fellowship, are you looking for?
Well, not sure yet. We're gonna see where I wind up. But yeah, not counting anything out, applying to a wide array of places, and then hopefully going to land somewhere that's going to be a good fit for me.
But definitely something in epidemiology, right? You're staying in the field?
Of course. Yeah. Okay. I've been working towards it for the better part of a decade. I wouldn't be leaving it now, especially when things.
Yeah, I was going to say right now is a good time to be kind of an epidemiologist, right? I mean, we definitely need individuals such as yourself out, kind of figuring out the best way to tackle diseases in general, in particular the COVID-19.
Yeah, well, it's actually like an interesting dynamic. So a lot of people that I've been speaking with, they're always like, "Oh, well, you picked a great field to be in at this time," and that's not necessarily true. I mean, from a job security standpoint, or economic standpoint, or however you want to phrase it, and it's also not good from a public health perspective. And let me tell you why. So. Whenever you have a disaster type situation, so whether it's a natural disaster like a hurricane or a tornado or something along those lines, or a health disaster like the Ebola outbreak or like the coronavirus outbreak that you're experiencing now, that causes massive systematic disruptions to the healthcare system. And that's a result of all healthcare efforts being focused on that single solitary situation. So right now we're focusing on coronavirus, as we should, but a lot of other things are going by the wayside. So we're not dealing with other infectious diseases. We're not dealing with chronic diseases. Research has basically ceased in these other areas, and all efforts of hospitals, public health agencies, both state and federal and even local agencies are all focused on the coronavirus response. And that's going to lead to deficiencies down the line in the other aspects of public health. So in particular to my research, I deal mostly with vaccine preventable diseases, and you can expect a massive disruption in the delivery of standard vaccines to both children and adults, because people are not going to be going to their local retail pharmacies or stores or their primary care provider to get their vaccinations because of the concerns around the coronavirus. So when this all wraps up at some point down the line, there's going to be a lot of catch up to be played with those various preventive care measures. So it's sort of an interesting thing that not a lot of people think about is when we're dealing with the coronavirus specifically, we sort of set everything else on the back burner.
Yeah, no, I definitely can appreciate that and see how the current pandemic is, taking front and center stage for anything healthcare related, and how everything kind of takes a back seat, and that we're definitely going to see the repercussions of that triage, if you will, down the line, where we gave priority to, like you said, as we should, to the coronavirus pandemic, but then everything else we're going to have to be playing catch up. So that's interesting.
Yeah, but in the Western nations like us and in Europe, we're going to catch up pretty quickly, but the coronavirus is going to have devastating, long-lasting repercussions in places like Central and South America, Africa, Southeast Asia. All of these countries are still dealing with massive threats to their global health from an infectious disease standpoint. So all of these programs that we have towards reducing and eliminating malaria and HIV, reducing the incidence of diarrheal diseases. All of those programs are going by the wayside now that we're focusing on coronavirus. So you're going to see a big uptick in mortality as a result of those infectious diseases globally, but specifically in those underserved areas, because of all the efforts that are being paid to coronavirus. And that's nothing to be said of the fact that coronavirus is going to hit those areas much harder than it hits the Western countries, because they don't have the healthcare delivery systems that we have here in the United States. And they just have less supplies, they have less personal protective equipment, they have less essential equipment like ventilators. They can't provide supportive care in the numbers that we can here in the United States. So when the pandemic finally reaches Africa, for example, in substantial proportions, it's going to be a very tough situation down there.
Yeah, no, I definitely can see that with the third world countries struggling a little bit more to recover from something like this, just because of from a resource allocation standpoint, third world country versus perhaps here in the United States, our recovery time. But what I thought was interesting is how the pandemic is displacing kind of all of these things that we would normally take care of that would be addressed, but then they get put on the back burner. And I can't help but think about how, a lot of people, at least at first, I think more people are catching on to this, but with the social distancing, the concept of flattening the curve, how part of it is you don't want to overwhelm the healthcare system with COVID-19 patients, but people fail to take into account that hospitals just don't see people that have COVID-19. You have all of these other things that hospitals normally have to take care of. You have people with strokes, heart attacks. Maybe they have some sort of chronic condition, like severe asthma attacks, things of that nature, where they would have to have access to the emergency room. But then, if the system was overwhelmed, they wouldn't do that, and they could potentially go and die as a result of not having access to the emergency care that they would normally get if there wasn't, a pandemic going on.
Yeah. So I sort of have three things that I want to say with respect to that. One is, yes, you are seeing, or you're going to see trouble with delivering healthcare to those people who have other sort of emergent conditions like heart attacks and strokes. It's going to present some challenges with people who do have other sort of comorbid conditions or pre-existing conditions like diabetes, for example, or hypertension. But there are going to be also a massive reduction in the number of car accidents that you're going to see and all of those sorts of things. Not saying that it's going to balance out, but that is another unanticipated effect. You'll probably see less car accidents, less gunshot wounds, stuff like that. So that's one thing. The second thing is, I think that maybe we should talk about a little bit later, because there's one thing I want to talk about first, but is the lack of insurance that individuals are going to have as a result of these layoffs and furloughs that a number of organizations are having to go through, dealing with the tough economic times that we find ourselves in. I read one study that estimated that there's going to be 35 million additional people uninsured within the next 3 months as a result of those layoffs and furloughs. And that's in addition to the 30 million people that are already uninsured in the United States. So you're talking about 75 million people in the United States. That's over a quarter of our population without insurance. And when you think about the healthcare costs associated with the coronavirus, the average coronavirus inpatient encounter is costing people about $35,000. That's like bankruptcy money to a lot of people in the world. And then the third thing I think we should talk about is the flattening of the curve, just what that means to people in general. And I think that might actually be a good place to start with everything. So I'm sure that everybody's heard the term flattening the curve, and they might not exactly know what it means. So the curve refers to an epidemic curve. So an epidemic curve measures the number of incident cases or new cases that you're having on a day-over-day basis. And obviously, if you have more cases in a shorter period of time, that curve is going to be much more going to arrive at a peak much sooner. And that peak is going to be drastically larger than if you had a smaller number of cases over a longer period of time. So when you hear flattening the curve, we want to get to a point where we're having a small number of cases over a longer period of time so we don't overwhelm our health system. And if we can flatten that curve to such a sufficient level, we can also reduce our mortality rates. So by keeping the burden on the health system low, we can treat every patient with the care that's necessary. We can provide appropriate palliative care, and we can get those people back healthy sooner. But if a lot of individuals get sick at the same period of time, if you have these massive outbreaks or super spreading events, then that's what's going to cause those peaks in the curve, overwhelming of the system, and increased mortality rates. So that's what it means when you say flatten the curve. So I just wanted to explain to your listeners what the importance of that is. And like, it's sort of a buzzword going around, but it, is sort of not defined in a lot of cases.
Yeah, some people, I mean, hopefully at this point, because it has been discussed ad nauseum by a number of different outlets, that people have a better understanding, but it's always good to go over it again. And I know that, from what I've encountered on like social media, let's say, there's some people that still seem to not grasp this concept. And what I wanted to ask you real quick about was, what do you mean by you said super spreading event? I was curious as to what you meant by that. Yeah.
Yeah, absolutely. Okay. So that's actually really interesting. So the super spreading event is an event where a lot of people are in a very small geographic area, and the spread of the virus is going to translate very easily or transmit very easily between individuals. But the sort of key to the super spreading events is those individuals are then going to fly to different locations and have isolated outbreaks. They're going to give rise to isolated outbreaks from their individual case. So, for example, here in New Orleans, we had Mardi Gras. And although there were no confirmed cases in New Orleans at the time, we have some pretty strong evidence to suggest that there was coronavirus here during Mardi Gras. It was being spread among the population. And then those individuals who were sick, who might have been asymptomatic, taking the plane home, then could give rise to secondary outbreaks as a result. But the more recent example would be spring break in Florida, where the local political, the governor of Florida chose not to take the steps that were necessary to inhibit the spread of coronavirus. So basically that would have been closing the beaches, closing the bars, closing the restaurants in South Beach, Fort Lauderdale, Tampa, or other big population centers. Florida as a state did not do any of those things. So there was a lot of free flow, mixing of populations, lack of social distancing. And there were a lot of individuals who became ill during that time and then took it home to their families, took it home to their friends, and were spreading it there. So super spreading events are these events that can take the virus to previously uninfected areas.
Okay. So are you referring to perhaps like large religious organizations like getting together and, holding mass or some sort of event, and then perhaps, a lot of people being in close proximity and then going out. But I suppose that they wouldn't be traveling across the nation or something like that where you would have it for, let's say, spring break.
They're definitely more localized, but that can definitely cause a cluster of illnesses. So a cluster is a cluster of illnesses is an occurrence when individuals that share a similar geographic region or location, like a church or a school or something along those lines, or apartment complex, something along those lines, where you see a high influx of cases. And you can see those cases occur very quickly within those enclosed spaces, and that would cause a cluster of illnesses. And that would be something that we would typically investigate if we didn't know the cause. But in this case, most of what these outbreaks and these clusters that we're noticing are in fact coronavirus. So we know exactly what they are.
Okay.
So, and that's sort of that sort of speaks to the different way that we are approaching the outbreak now. So in the infancy of an outbreak in something like a respiratory virus that's extremely infective and can spread very rapidly, you have a very narrow window in which you can prevent widespread outbreaks throughout our country, in this case, the United States. If you miss that window, your focus shifts from preventing the outbreak to flattening the curve. So in the United States, our perspective is switched from preventing widespread outbreaks, preventing it from reaching every state in the United States, preventing people from becoming ill, being sure that we don't have this sort of widespread spread or transmission of disease. It shifted from that to flattening the curve. So we've come to expect that a significant number of Americans are going to become infected with the coronavirus. A significant number of Americans are going to die. But by flattening that curve, we can reduce the number of Americans that would die if the curve had been flattened opposed to there been a big peak overwhelming the healthcare system. So our goal now isn't to reduce infectivity over the long term, because we've accepted the fact that probably somewhere between 40 to 70% of the United States population at one point or another is going to become infected with coronavirus. What we want to do is we want to reduce that mortality rate from the 3.5% that you typically see put out there down lower and lower and lower, preferably as low as possible. If we can get it, less than 1%, less than 0.5%, or even 0.1% of 1%. So, again,
and one of the ways that we do that is flattening the curve, right?
The only way we do it is by flattening the curve. Or
reducing the mortality rate. I know that they're looking at various sort of medical interventions or medications, let's say, where you can, once you contract the virus, that it can help to, I don't want to suppress or do something to your body's response so that it increases your survivability and lowers the mortality rate. Now, I don't know if anything is on the market yet. I know that the president has touted a few different medications not recommended by the scientific community.
None of the medications, to my knowledge, that the president has brought up have shown to be efficacious in reducing has been shown to be efficacious in reducing mortality or severe illness. But so what you bring up is a great point. So there are a lot of things that reduce mortality, right? The number of doctors that we have, the number of nurses, the number of ventilators, the number of palliative cares that we have, or treatments or something along those lines. But the problem is we have limited resources, and the number of resources that we have are generally fixed insofar as we can't bring many more medical professionals in. We can't bring more nurses in. We seem to be stuck in this quagmire where we're not producing enough personal protective equipment like N95 masks, face shields, scrubs, gowns, all of those sorts of things. So right now we're at a point where the resources that we would use to decrease the mortality rate are being exhausted. So the only thing that we can contribute as a society right now in this moment, before we have a vaccine or before we have more readily available treatments, is to flatten that curve so we don't overburden the already thin amount of resources that we have. So that's what we need to do as a society, is move towards flattening that curve.
So social distancing and hand washing.
Yeah, absolutely. But there's a lot of other things that you can be doing. So, and obviously these are all gonna vary based on your personal situation. So there's a lot of people, unfortunately, that have lost their jobs or work in industries that are on the front lines, like the grocery store workers and tellers, gas station attendants, nurses, doctors, all these individuals. Like they can't prevent themselves from being exposed to the virus. But others of us, we can self-quarantine, we can isolate. There are things that a lot of companies have done to, for example, going remote holding meetings via Zoom, not bringing people into like an office and stuff like that. So there's actually been like, that's one of the few things that's been encouraging about this outbreak is a lot of things happened on a local level from private corporations and private businesses that helped and aided to flatten the curve. So if you're a business owner, if you haven't already, obviously sending your employees home, working remotely, doing everything that you can to maintain a sort of clean area like within your home. So obviously people are going to have to go out. You've got to get groceries and everything like that, but being knowledgeable and being cognizant of what you're doing while you're out there. So that would be wearing gloves, wearing a face mask, and wearing them properly. So and this was actually a thing, Natalie, my wife and I, we went to Costco. She put on her gloves and then she touched her phone. And I was like, babe, once the gloves go on, you can't touch anything else. You can't touch anything else that you're bringing back with you or into the car because you're turning that thing that you touch into a fomite, which is an inanimate object that can carry the virus. So if you touch anything with the gloves that you wouldn't touch with your hands, you're turning that into a potential vector for the disease. So you need to be cognizant of proper glove use. Don't reuse them, dispose of them after you use them. Masks, use cloth masks, but wash between uses if you're using a bandana or any of the number of things that you can see. Social distancing, hand sanitizing, washing your hands properly. So for 20 seconds, all the way up to the elbows.
I don't think a lot of people do. I don't think a lot of people wash their hands like that.
Yeah.
All the way up to the elbows. I know that I actually don't do that. When I wash my hands, I apparently I should start doing that. I mean, I go past the wrists, but I don't go all the way up to the elbow. I didn't realize that. So you got to wash your hands like a surgeon.
Yes. Well, think about it this way. When you wipe your face like this, you're wiping your face with your whole forearm. And if you have virus that's sitting on your arm, you're now transmitting it to the mucous membranes.
Okay.
Which sort of goes into, talking about what coronavirus is in terms of its disease group. So it's a respiratory virus, but it's spread via droplets. So it's not airborne. You can't be in a room and, inhale coronavirus from somebody who's like 30 feet away from you. It's spread by close contact via respiratory droplets. So droplets are something that's secreted when somebody sneezes or coughs. It's a small microscopic amount of mucus that's expelled and contains some amount of virus. This lands on surfaces, or it can land on you or your hands or something along those lines. And then when you go and if you have virus on your hands, for instance, you touch your eye, you touch your mouth, that would be a way for the virus to come into your body and actually infect you. And the other way is if you touch an item that has virus on it, if it's been sneezed on or coughed on or something along those lines, like
so that's the fomite.
That's the fomite. Okay. Then you touch that, you touch your eyes, you touch your nose, you touch your mouth. That would be the way for the virus to enter into your mucosal membranes.
So this is why it's so important to sanitize surfaces as well, on top of all of the stuff. Absolutely. On top of all of these other things that you can do, but sanitizing, making sure that you're sanitizing surfaces.
Well, what is a great way to help yourself out individually is setting up an area like a quarantine area or a cleaning area when you come into your house. So you can be sure that your house is actually cleanly, whether or not that's like a garage area or a mudroom or laundry room or something along those lines, where you can clean and sanitize everything that you brought into the house, change clothes, do whatever you may need to keep yourself clean and safe, and be sure that the products that you're bringing into your home aren't vectors for the disease.
I see. Now, real quick, I wanted to ask you about the face mask, because when this all first started happening, the WHO did not recommend that you wear a face mask, at least a regular face mask, because they said it would be useless. If it was an N95, then that's a different story, but that you shouldn't be wearing regular face masks because it's pointless, and that the hospitals, that's just going to take resources away from the hospitals. Now it appears as though they've changed their stance on that in the past couple of days or so. So I was curious as to what your thoughts were on all of this, so that way that obviously the public can get the best information available.
No, absolutely. So yes, wearing a face mask back when case counts were relatively low didn't necessarily make a whole lot of sense. And the concern was if you recommend everybody starts wearing face masks, that's going to result in people starting to hoard medical supplies, which ultimately occurred anyway. But N95 masks, the big difference that they have from just like a regular surgical mask that you'd see or something that you would make out of cloth is it actually has a respirator that will filter out the virus because the virus is too big to fit through the respirator, completely encloses the nose and the mouth area. So no virus is actually able to get into your mucosal membranes. So that is why you would do it. And combined with a face shield, you have eye protection then. So if you were to get sneezed directly in your face and you've got an N95 mask and a face shield, you wouldn't get infected. So that wouldn't be true of a surgical mask because you could still have virus, sort of come through around the sides and everything like that, and you could still get infected. But it prevents an effective barrier if you were to accidentally, say, touch your face or something along those lines, or if if you were just coming in contact with individual people and everything like that. You don't require that degree of protection that an N95 mask would present. So it's still a good idea to wear a face mask. It's good practice, but it's something that wasn't, recommended until now. And the reason for that is we're reaching rates of infection where you can expect to encounter a good number of infected people every time you're in a situation like going to get food or something along those lines.
Okay. Yeah, I didn't look at the numbers today, but is it over 200,000 or 300,000, something like that, active cases in the United States currently?
In the US, there are 425,000 cases. 388,000 of those are active, and there have been 14,590 deaths in the United States as of today.
As of today.
Mm-hmm. Yeah.
Yeah, that number, we're still on an exponential trajectory, and I don't know when. Do you know when the projected peak is? I know it's different from state to state. Do you know what on average it is for the U.S. though? They're thinking right now.
The peak of this virus could, be anywhere from the next couple of months all the way to 12 months out. I mean, it just depends on the effectiveness of social distancing measures that you have. So, you've probably heard a lot about mathematical modeling and everything like that. And that's where you get the idea of like, oh, we've hit the peak, and things are going to turn around. So all these mathematical models are based on certain assumptions, and obviously we know some of those assumptions better than others, and there are things that we can control and we can't control. But generally, right now, what we're looking at to determine when the localized spread of the virus will stop is we know the basic reproductive number of the virus, so that you've probably heard. If you've watched the movie Contagion, which a lot of people have at this point, they say R naught this, R naught that, R naught whatever. That's what the R naught is. And it's basically the number of secondary cases that you can expect as a result of a primary case. So if I'm one person and I'm a index case and I have an R naught of 2, I can expect to infect 2 other people. If it were 3, you would expect 3 other people, and so on and so forth. And basically, what you're calculating in these models is you're calculating a herd immunity threshold. So herd immunity is the number of individuals that you need to have the disease to prohibit the spread of the virus within the community. So there are too many people who have immunity to allow the virus to propagate through the population. And it's a super simple calculation. It's just 1 over the R naught. So we know the R naught's 2, 1 over 2 is 50%. So that's where you get the numbers of you expect 50% of the people in the United States to become infected before you've reached the sort of epidemic peak.
Okay.
Yeah. So, and you can do a lot of things to reduce that basic reproductive number. One would obviously be if you had a vaccine. So if you had a vaccine, and let's say you even vaccinated 25% of the population, you would only need to have 25% of the remaining population be infected to reach that 50% of herd immunity threshold, assuming you can't be reinfected with the virus, which we don't know if you can or cannot at this point.
Mm-hmm.
So there's a lot of things like otherwise that we can do too by using our social distancing measures, by closing businesses. You're reducing the number of people that you come in contact with, and that can reduce that basic reproductive number. So basically the goal of any epidemic model is to bring that reproductive number below 1. So that would say if I'm one person and my reproductive number is 0.5, I'm only going to cause a half a case. So that's when you start seeing that downward trajectory of the epidemic curve, because you have each individual giving rise to fewer cases than have been caused in previous generations.
Okay. So, yeah, that makes perfect sense. And I think really highlights the importance of having a vaccine. Mm-hmm. On the last podcast that we did, we were talking a little bit about vaccine hesitancy, anti-vaccine movements, or the rise of anti-science movements in general, and the effect on vaccination rates. And I'm hoping that the world is going to learn a very valuable lesson from seeing what it's like when you are presented with a novel infectious disease that we don't actually have a vaccine for, and how severely it can disrupt society.
So I think that there are going to be a lot of societal, economic, and political changes. And I think that this pandemic is definitely going to change the mentality of people on an individual level. So I sort of look at it like, I'm not, by no means am I a professional in psychology or anything, but I remember back from a bachelor's psychology course, there was this thing called Maslow's hierarchy of needs. And I'm not this is a very layman sort of situation, but basically Maslow hypothesized that there is sort of this baseline need that you need to satisfy. First, you need food, then you need water, and then you need shelter. And then from there you build entertainment and you build arts. And as you become more and more and more developed, your needs become more and more and more refined. And how it sort of applies to this situation, at least in the way that I look at it, is we were so safe for so long from all of these things like just massive wars that involved every single corner of the world, massive pandemics, massive natural disasters. It's just like of course, all those things happened on a smaller scale, but we were very insulated. There was nothing that sort of shook our very foundations of what it was to be human and mortal. And as a result of that, I feel like a lot of people were able to develop these anti-scientific and altogether backwards sorts of beliefs. The things that we prioritize, we were only able to prioritize because we reached such this pinnacle of development. And this is a real reality check to a lot of people. And I think ultimately what it's going to result in is people realizing that we need to reprioritize some of the things in our life. And if ultimately, that means, shifting to a Medicare for all type of health system, because you can't have 25% of your population be uninsured and be susceptible to this sort of disease and this virus, or it's people who are anti-vaccine, reevaluating the type of situation that they're in and saying, hey, maybe these things aren't so bad. Maybe we should listen to the science. So I think that there's going to be a lot of fallout. And I think that it's going to be a result of us reevaluating sort of what it is to, be human and have these external threats that are actually like a direct threat to our day-to-day sort of everyday lives.
Well, yeah, I couldn't agree more with you. And I really, really hope that this is a wake-up call for a lot of people. Just because, like you said, I think that we've grown way too complacent and kind of don't really appreciate what we have. There's that saying, you don't know how good you have it until it's gone, or you don't know what you have until it's gone. So this is kind of one of those moments for humanity, for us as a species. We didn't realize how good we had it with our technologies until suddenly we find ourselves in a scenario where we don't have our technology. And one of the reasons why I'm really, really hopeful that this serves as a wake-up call for a lot of people that they should start listening to the scientific community more is because I'm very, very concerned about climate change. And there's a lot of people still who kind of think that that's not real, that we don't really need to do anything about it. In particular, our president says that, at least at the beginning, he said it was a hoax, but he still doesn't seem to appreciate, any science whatsoever, but particularly when it comes to climate change. And I know that with climate change, it is also moving on what's going to be an exponential trajectory. And so you're going to start seeing rates of changes from a temperature standpoint, destabilization of climate patterns. So more storms, more severe storms, not just storms, but natural disaster type events associated with climate. So I'm just really, really hopeful that, that not only does this kind of shake people from appreciating the vaccine side of things more, but just appreciating the scientific community more. And then, hey, these are experts in knowledge essentially. And when it comes to serious issues such as a novel virus or the changing climate, these people know what they're talking about. And when they are raising red flags saying that, hey, we need to make serious changes, we need to pay attention, that people start paying attention more.
Yeah. I mean, the implications for climate change, I mean, specifically as it relates to novel viruses like coronavirus, are absolutely staggering. As the climate warms and we are increasingly engaging in practices like deforestation or industrialization, humans are coming into contact with species that we don't normally come into contact with. And that's sort of what gave rise to the coronavirus in the first place and was the cause of Ebola back in 2014, and is the cause of any number of diseases that you can look back on in history. But there's these species that exist out in the world that are reservoirs for diseases that we don't even know about yet. And in this case, so a reservoir is an animal that carries a disease or a virus, a bacteria, some sort of pathogen, but is unaffected by it themselves. So they live in a state of symbiosis with it. But those species, although they might not necessarily infect us, they infect intermediaries. And in the case of Ebola, it was bats infecting chimpanzees, which were then hacked for bushmeat and then transmitted the Ebola virus, to humans. And what happened in the case of the coronavirus is a bat came in contact with a pangolin, which then transmitted the virus to us and humans. And that's sort of the thing that we're most afraid about in flu research, is not bats, but birds, for example. We don't get infected with the bird flu, hardly ever or at all. But all it takes is the wrong bird to come in contact with the wrong pig, have a recombination of those antigens, and then we could have another global pandemic on our hands. And as we are increasingly coming in contact with these species, the chance that we're going to experience another novel pathogen like coronavirus increases exponentially. And that's to say nothing of diseases that are currently bound by the current climatological zones that we have. So for instance, like malaria and dengue and Zika are all mosquito-borne viruses that live in a typically narrow band around the equator. But as the climate warms, the range of these insects is going to increase, and these pathogens are going to be reintroduced into our society, the Western societies. So there's a lot of combinations of factors that are, and there's also another one too. There was I think it was a caribou. I'm not 100% sure. Don't quote me on it. But it was frozen in the permafrost in Russia. And when that permafrost melted, the individuals who discovered whatever animal it was were infected with anthrax, and it caused a widespread outbreak of anthrax. And that's a pathogen that had lived and existed in the permafrost, melted, and then infected a whole group of individuals.
Yeah, so potentially for thousands of years, or maybe not that long, but who knows?
Not in the case of anthrax, but there could very well be
I mean, there could be unknown sorts of pathogens that are frozen, right? And that are completely foreign to us. They haven't been around, like on the surface, surviving for a while, and for whatever reason, then they become released due to thawing permafrost, and then you got.
Yeah, I mean, I don't want to sound like a conspiracy theorist or like I'm on the X-Files or something like that, but it's certainly possible for us to become exposed to previously extinct species or new species that we have yet to discover in these colder parts of the world, and that could cause, massive. It could have a massive impact on human society. So, but sort of like the takeaway that I get from the climate change discussion and the discussion around just advancement in general is it seems like as a human species, we only advance more and more on the precipice of destruction or total annihilation. I mean, it seems like that's where we have these massive, massive steps forward or leaps forward even in society. And I mean, we saw it post in, post World War II, for example, or even during World War II. We had things like the atomic bomb that were developed, but also made massive scientific strides forward, and aerial technology and medicine. And we developed penicillin, we developed the smallpox vaccine, we developed all these sorts of things. And, at the turn of the century, we were, not this century, but the previous century, the turn of the 20th century, we were afraid that everybody in the world was going to starve, and we didn't have enough people. We didn't have enough food to feed everybody. We were actually harvesting bat guano off like islands out in like the ocean and everything like that to bring home as fertilizer. And that we met the challenge. We had the Haber-Bosch process where they fixated nitrogen from the air, and they fixated it in the soil, and made farming and more land arable. And I don't know. I'm just hoping we don't have to get to the point where it's like 1 minute to midnight or like 1 second to midnight or whatever it may be for us to realize that we need to make some drastic changes in the way that we approach this, tiny blue marble that we live on. It's the only one we have.
True. Yeah. Our blue and green spaceship that's floating in a void of blackness.
Right.
It seems, it's very strange how it seems on average we're very short-sighted in so many ways. Yep. But then when we come together in times of need, the things that we can accomplish, it's just remarkable. It's absolutely remarkable. But my only concern about global warming is that the processes take so long from like an exponential growth model. Like it's very, very slow in the beginning. And we saw this with the current pandemic. It's very slow. And then all of a sudden you get explosive growth. And then if we do this we allow this to happen with global warming, then, we're going to find ourselves in a situation where we don't know what to do. Like we're going to be losing entire ecosystems, and we just don't have the technologies in order to fix it. So that's the only reason why I'm still very concerned about global warming, is because of how long it's actually going to take to correct course. Because even if we were to shut off CO2 today and all other greenhouse gases, you would still see rising temperatures for decades. Maybe not. Yeah, actually, because CO2 stays in the atmosphere, it has a half-life of like 200 years or something like that. So not only are we going to have to develop technologies to reduce our greenhouse gas emissions, but we absolutely need to develop technologies that capture greenhouse gases and fixates them out of the atmosphere, and so we can do something with them other than leave them in the atmosphere to continue to warm the atmosphere. So
yeah, absolutely.
It's all very a little bit concerning, but it's things are definitely interesting right now. I try to tell people that the world is not ending. It's just we're going to have to get used to a different way of life in the immediate future.
It's not even just the immediate future. It's until we can have, until the vaccine is, until the, I assume the vaccine is, going to be imminent. Insofar, by imminent, I mean in terms of vaccine development, it is going to come much more quickly than a typical vaccine will, because like we've been talking about, great advancements happen in society when humanity is tested. But I'm still not expecting a vaccine to be approved and ready for distribution for another 12 to 18 months. So this is going to be our reality for a long time, and people should be prepared to hunker down and, I hate to say it, but sort of become more accustomed to these solitary sort of lives that we're leading now. And I mean, the only thing I can say is we need to take advantage of the technologies that we have to be sure that we're not isolated, like FaceTime and Zoom like we're using now, and Skype and all that sort of stuff. But we need to be finding sort of alternative ways to relate to one another. And I mean, from a public health perspective, I imagine that we're going to see massive increases in the rates of depression and anxiety and all sorts of mental health disorders because people are sort of confined to quarters. I also imagine that there's probably going to be increases in domestic abuse, not to mention increases in poverty and increases in chronic diseases overall, because, you know, people are unable to be eating healthy. They're living in poverty, eating processed foods, all those sorts of things. I mean, we've already seen the data is bearing out that people of color are disproportionately affected by this pandemic. And it's not something that I'm particularly surprised about, because these are people of color are typically individuals who already have higher rates of chronic conditions, higher rates of poverty, lower rates of insurance. And those are the individuals that are like unsung heroes that are working grocery stores, bus drivers, working, you know, in public transportation. Those are the people who are our essential workers that we never thought were essential before, but they're getting underpaid and overutilized right now. And that's exposing them to the virus in greater proportions. And once infected, African American or somebody who's Hispanic or any other racial minorities, they're far more likely to die than us, us non-minorities, us white folks. And that's really unfortunate, and it sort of speaks to the overall society that we've created here in America. So I guess my point there is, I hope that this changes how we look at people, how we
absolutely,
people.
Yeah.
Like
the whole essential worker thing too,
exactly.
And then looking at the statistics and whatnot. But the cashier at your local grocery store, that's an essential person.
Mm-hmm.
And how many people would have thought that before this? Right. And then
the person who picks up your trash, the person who drives your bus route, the mail people who are delivering all of our packages, all the UPS drivers, the USPS workers, all the people who are working in Amazon factories right now or Amazon warehouses, I mean, to produce like essential goods for us. It's just, I hope we reevaluate what we look at as essential and realize that, those people who we need right now can't survive at like $7.25 an hour. Those people that we consider essential need to be, incorporated more into society, be given fair wages, be given health care. And, hopefully it'll contribute to a more egalitarian society. Because even when you saw massive even disparities in testing, right when tests became available, you saw people who were very wealthy and affluent who were getting access to these tests over people who were, more middle class or poor. And that's just really unfortunate that we've got such a huge divide and disparity in America. And hopefully that'll be one of the consequences of those viruses, is people realizing that, we all are part of a community. We're part of a unit. Like, not every one of us is like this rugged individual who's going out there and, making it in the world on their own. We're dependent on other people. And I think that's why, we've seen such a drastically different response in the outbreak or the pandemic in Eastern countries compared to Western countries. And that's why you've, I think, seen Eastern countries more effectively control this pandemic, is because they have this more communitarian perspective as opposed to our individualistic perspective here in the West. So I think that there's some things that are at play there.
No, yeah, absolutely. It's all very interesting. Bear with me for one moment. I actually have to plug my computer in here before I lose you. There we go. I forgot to do that before we started. Anyway, I think that's really interesting that you think that the East, one of the reasons why they had such a better response to all of this is because of the more of a community feel. And I know exactly what you're talking about, that they embrace versus our more or less rugged individualism here in the States, where, even though we live in a community and depend upon all of each other, and, at the end of the day, we are human, we're primate, the vast majority of us are fond of the company of others, even us introverts that don't find this too terribly difficult. We still need to interact with other humans. That has led to perhaps a poorer response just because of that little tweak in philosophy of just not embracing the community that we live in as much. I mean, and it's completely antithetical, in my opinion, to what it means to be a human. Like, we live in groups, that's what we do, and we're all dependent. Society is so incredibly complex. There's no way, unless you're willing to go and live in the Alaskan bush, which some people do, by yourself.
I've seen the History Channel.
Yeah, I've watched that show. So it's all very interesting.
I think it's a huge difference in perspective. So I feel like Westerners generally view the world, society, as a zero-sum game, where for you to benefit, somebody else has to, suffer. They have to come up short. So they view things as there's limited resources, there's limited wealth, there's limited power, and it's just, we try and snatch up as much as we can, and we try and hold on to it because we're so afraid that we're going to lose it. And we don't even realize that none of those things are the things that are important. Like, there's more than enough to go around. There's more than enough for everybody to have enough. I mean, the world that we live in is bountiful, but yeah, it's just a perspective that we have here in the West. And I think that not even just that we have as individuals, but we have in our foreign policy at national level, at the national level. I truly believe that there are a lot of Western countries that believe that to succeed, necessarily other individuals must suffer or must fail. Mm-hmm. And that is a horrible way to look at things, and entirely non-productive.
I mean, the pie isn't static. There's nothing written anywhere that says the pie is static and it's one size. And if you, like, this is the zero-sum analogy that you were talking about earlier, that you have a pie, and that if you want more of the pie, you have to take it from somebody else. I mean, it's dynamic. You're able to grow it, and part of the prosperity that we've enjoyed over the past 100 years or so is because we've developed various technologies and processes and things of that nature in order to expand that pie to make it bigger. So that way, everyone can have a little bit more. And I'm not saying that it all has to be the equal size, right?
No,
but yeah,
I don't think anybody's at least I'm not, but I think that I'm not talking about like a massive like Marxist redistribution of wealth here or anything like that, but or even like any sort of redistribution of wealth. I just am talking about like the perspective that we have and the way that we view ourselves and the way that we view others and the way that we interact with people. I think that we have this mentality, and I think that mentality is a cancer, and it's just pervasive and corrosive, and it's just all consuming. And I don't know, I'm thinking that, or hoping at least, that as a potential I don't want to say silver lining, because obviously I wouldn't wish, if I could go back and, solve the pandemic before it ever happened, I obviously would. But I'm hoping that we realize that people matter in general, and that everybody is useful and everybody is a producing member of society. And like, that's why I always am just so frustrated the way we look at things economically here in the United States. It's just like you talk about, wealthy individuals, and you talk about like resistance to taxing them and putting them in like lower tax brackets and whatnot. And they're like, oh, well, these are the people who are producing the wealth. They've made all this money. They should, be able to keep it. And I'm like, well, the reason why a person is wealthy is because we're buying their goods, or we're using their services, or something along those lines. Like, a person doesn't get wealthy just because they fabricated money out of, thin air. It's because they're part of a society that has contributed to that wealth. And I think that we need to, have a different perspective on that as well. That, we need to start looking more towards the collective and the community as opposed to the individual.
Yeah, I categorically agree. People over profits. That's, I think, one of the biggest things that is hindering our society and causing it to slide backwards currently is the development of a capitalistic society into what is called like crony capitalism, which is just the maximal pursuit of profits above all else. And just the outcomes that leads to doesn't always mean that it's the best for society. So anyway, yeah, super interesting. One last thing that I wanted to ask you before we wrap things up here is so China's now out of lockdown. So they were in lockdown for approximately 2 months or so.
Well, okay, so let's equivocate what that concept. So a lot of people are thinking like out of lockdown just means we snap our fingers, everybody's back to work, the economy's open, we're going, gong ho, full bore into, just everyday life. That's not the case. So China's selectively opening up various parts of their country and their economy, and they're doing things at a very measured pace. And that's how the United States eventually has to come out of this quarantine situation that we're in. So there are going to be a lot of stutter starts, like there's going to be a lot of stops and starts. So when you open back up society, the economy, when you take away a lot of these restrictions that we have on travel, there are going to be additional outbreaks. There is going to be increases in case counts. The important thing is we realize that we've tested it, and then we need to revert back to the quarantine. So I'll let you go on with your question, but I just wanted to be clear, like China isn't just opening everything up. Like they're taking a very measured, very intelligent approach to how they're opening back up the country in general.
No, yeah, I appreciate the clarity. But yeah, I was just curious as, okay, so China's now coming out of a quarantine or lockdown, whatever sort of terminology you would like to use, and they're doing it in the most judicious manner possible, which is a little bit here and a little bit there. And I was curious as to if any new data is coming in yet about not reinfection, but new infection. Like the cases climbing, or are they continuing to go down, or what's going on here? I mean, I'm assuming that you're going to get new infections as you relax social distancing measures, but the key is going to be, is this something that the healthcare system can bear? Are the new amount of infections something that we can handle, and then we can continue up to a point? And then once we get to that point, we can't really open up anything else because how would you even go about gauging that? What are you seeing from the Chinese numbers?
Yeah. So far as I know, we don't have any, new and fresh data out of China, other than just regular sort of case counts that have been rolling in, which are still very small and unsubstantial. And they're in the infancy of, sort of reopening things back up. But so this sort of goes to like a larger point in tactic in deal with widespread outbreaks or pandemics is, so the whole purpose of quarantine is, yes, to flatten that curve, but you're reducing the number of individuals who are infected with the virus and can transmit it. So for every individual that you quarantine and you keep out of circulation, you're preventing 2 cases. And those 2 hypothetical cases, you prevented 4 cases. And from those 4 hypothetical cases, you prevented 8, and then 16, and then 32, and 64, and 128. So by preventing the spread of that 1 case to 2 people, you cut off a whole branch of potential infections. So the whole goal is to reduce the number of individuals who are infected with the virus to sufficiently low and acceptable number to believe that by opening back up certain parts of the country and the economy, it's not going to lead to substantial widespread outbreaks. Mm-hmm. And they're able to do that now because there's one factor above all else that is just absolutely essential in any sort of outbreak response, and that's the ability to count cases. So the fact that we have, fast and expeditious tests now, and they've lowered their cases to a small number, they can test people very rapidly, they can identify new cases, and they can identify close contacts and quarantine those individuals. So they've reached such a point from a public health perspective that they feel like they can prevent any sort of widespread outbreaks going forward. And obviously, if they're incorrect in that assumption, then they can shut back down. And go back into quarantine. The United States is nowhere near where China is in terms of controlling the spread of disease. We're still seeing massive day-over-day increases in the number of cases, and that's particularly true in a number of hotspots around the country. And in New York, for example, New York has more cases than any other country except the United States, and that's only because it's part of the United States.
Yeah.
So it's just like a massive hotspot for infection. But the United States is just now, 4 months into the pandemic, getting to a place where we can test people in sufficient numbers to identify cases quickly enough to be able to do the contact tracing and be able to selectively quarantine individuals. So it's taken us a long time to get here, and that's why we've got so many cases, frankly, and our cases are a drastic underrepresentation of the number of true cases that we actually have. So the cases that are being counted, those are confirmed cases. Those are positive tests. But there's been some evidence to suggest, using data from China, that the true number of cases is up to a factor of 10 lower than the actual number of cases that we're experiencing. So the United States has 425,000. That could potentially be something like 4 million cases. And that's just because we haven't developed the testing capabilities to test everybody who needs to be tested. So where was I going with this? In general, the United States just did not respond effectively or adequately in the initial phases of the outbreak. And you can compare the United States to places who have successfully addressed the outbreak. And Germany is one, and South Korea, I would say, is the other, that are just 2 giant success stories. So if you look at Germany, it has roughly the same amount of cases as France and Italy does, confirmed cases, but their deaths, I'm looking at the numbers right now, Germany only has 2,200 deaths compared to 17,000 in Italy and almost 11,000 in France. And that's because Germany identified cases earlier. Their case count more accurately reflects the true case count, and they've got lower mortality rates because they were able to identify individuals sooner. And the same thing is true in South Korea, where there's just massive widespread community testing. So testing is the true key to the beginning of developing an outbreak response. And the United States just hasn't had the capacity to do that yet.
And you wouldn't say that the United States response or lack of response was because of lack of information, correct? I mean,
No,
they had the same information as every other country, because I know that the President Trump initially called it a hoax, and then transitioned it, various stages as it got worse and worse to, I knew about this all along, and now he has recently, in order to cover up all of the lack of initiative on his end, not wanting to do anything, in my opinion, because he feared that it was going to hurt his chances for re-election. He is now scapegoating the WHO and threatening to withhold funding, and it's just unbelievable.
Well, the Trump presidency is such an interesting sort of case study, because Trump often, I've said this a number of times, hey, babe, he's eating a hat. Our dog's eating a hat right now. But
that's not good.
No, not at all. We saved it though. But so what was I saying? The Trump presidency exists in this post-truth society where facts don't seem to matter, and the only thing that matters is the spin or the narrative that they suit. But they've come, that mentality can only take you so far, because when you're crashing with something that's an inevitable and immovable force like the coronavirus, if it's something that you don't address, it is something that is going to propagate through the population. When you bring that mentality in, you just reduce every possible capacity that you could have to ever hope to control the coronavirus. So just the policies from the top down in the federal government were just completely bungled from the very beginning. And to your initial question, no, it wasn't because there was a lack of information. I mean, the first case was confirmed in China December 31st, and we didn't truly start becoming concerned with coronavirus response until maybe early to mid-March. So there was a substantial amount of time to become prepared here in the United States, but there's a lot of things that are wrong with the public health system here in the United States. But a lot of it comes back to funding and the defunding of essential organizations like outbreak and pandemic response teams at like the federal level, cutting CDC funding, making the CDC more of a politicized organization as opposed to an independent organization. It just becomes very difficult. And and I mean that speaks to our overall, sort of political system. But I mean, I don't want to go too much down a rabbit hole talking about Trump, because I mean, we could sit here all day and talk about him and, how he responded and to this particular thing and how he's been acting the past, 3 years or so. All I'll say is, I'll leave it at this, is that from an objective standpoint, this isn't my belief or anything like that. You can look at the response in America and you can compare it to successful countries, and you can say that the policies that were implemented by countries who were successful at curtailing the coronavirus outbreak were not implemented here in the United States, and to a large extent, those were because of political reasons or the lack of political will. So, and I will also say that the Trump administration is not a reliable source of information. So when you're going out and you're looking at information on how to protect your family, you're looking at, what potential remedies that you could use or how to protect yourself. Don't go out and try and buy chloroquine, people. It's not going to work for you. It's not going to reduce the severity of your disease. There's nothing that is proven that. And it's just like, that's just one example of President Trump touting a drug that has no proven connection to reducing the severity of the coronavirus. But I mean, there's endless examples. It's just the information that you get should come from more reliable sources, more vetted sources.
No, yeah, absolutely. How unfortunate is it that the people of the United States can't get good information? They can't get the facts from our current administration.
Yeah. And it's unfortunate because even some news sources, so I would say specifically Fox News in this case, is a major news organization. I think it's the #1 viewed news station in the entire country, and it basically disseminated what amounted to propaganda in the beginning stages of the outbreak here in the United States. And they've since shifted, but it's irresponsible reporting from an organization that claims to provide news to the people, and they're reporting things that are just completely untrue and have no factual basis. And that's the #1 news source for people in America. So it's just, we've reached like a perilous time for information and for truth and for facts. And people are having to go to degrees that they never had to go to before to validate the information that they're getting from people who they are supposed to be able to trust. Yeah. So I would just say, in these times, just don't rely on information that you can't vet, that you can't determine where the source came from. And I mean, a perfect example is the White House's estimate now that they're expecting between 100,000 and 200,000 deaths in the U.S. That's based on no model, no factual basis. The CDC hasn't shared any information that's validated that number. It's just a fabrication at this point. So I mean, that's something that's been touted by the Trump administration. It's saying if we have only 100,000 deaths, we will have been successful in preventing this pandemic. But it's not based in facts. Like, there are no models to show that.
That's just like, hey, let's just pick a random number out of a hat.
Yeah. And
between
I will
100,000 and 200,000, and like that's what we're gonna go with.
That number did, to my knowledge, come from Dr. Fauci, he's the head of the National Institute of Health, or National Institute of Allergy and Infectious Diseases, and #1 infectious disease doc in the country. But I think that was just something that was a personal, like, sort of assumption or something along those lines, like saying that's what he expected, but it's being taken as like fact and sort of run away. So it's just like, again, vet where your sources are coming from. Like, there was a truly astounding piece that was published by the Imperial College out of London, and they ran all of these different sort of simulations and mathematical models, and those are like the numbers that we should be using, and those are the numbers that we should expect to see. And like, that's just rigorously scientifically validated, peer-reviewed information. And thankfully, that information was disseminated in the popular press, but you didn't see anything about it on the CDC website. You didn't see anything about it, in press releases or anything like that. You didn't see Trump talking about it. So you don't see facts being talked about and disseminated in proper proportions.
Okay.
Yeah. So that's,
and what are the numbers saying? So based off of the best science that we currently have available, what is it looking at as far as the total number of infections? I know that you said 40 to 70% of the population will contract COVID-19 or contract the virus, and then what percentage would you say are the number of Americans that will unfortunately lose their lives to this?
Yeah. So the Imperial College London, the study that I mentioned before, this was published a couple of weeks ago, and obviously things are fluid and ever changing, but they published a variety of scenarios. So like I said, these mathematical models, they're based on assumptions. So they selected different assumptions and came to various mathematical conclusions based on those assumptions. So they said if we did nothing in the United States, we could expect 2.2 million deaths. And if we sort of have moderately embrace these sort of quarantine procedures, social distancing, all of these sort of moderate approaches to controlling the pandemic, we could expect about 1.1 million deaths. And if we did more rigorous sort of prevention methods, then it would be less than that. I'm not sure what the figure for that is. I don't know if they ran it for less than moderate.
But still, more than 100,000 to 200,000 is what the Imperial College is thinking.
100 to 200,000 is beyond any sort of, short of us having a vaccine becoming very expeditiously available, I cannot see the United States having just 100,000 deaths. It seems very low to me. The 1.1 million figure seems a whole lot more accurate. So let's go based on the numbers that we're expected, the number of cases that we expect to see here in the United States. And that's all based on those herd immunity thresholds and the figures that we talked about earlier. So we can expect anywhere between 100 and 150 million cases in the United States. All right. We have an accepted mortality rate of about 3.5%. So if you look at mortality rate of 3.5% and you expect between 100 million and 150 million cases, I mean, at 100 million, that would be 3.4 million. At 150 million, that would be 4.9 million. So you would expect to see that many deaths if that mortality rate held true. The mortality rate's likely inflated because it's only counting confirmed cases. And the United States, for all of its failings in the public health response, does have some of the best hospitals, medical technology, best doctors, best nurses in the world. So you can expect the reduction of that mortality rate based on that. And then based on those social distancing measures, the quarantine procedures, everybody working from home, isolating confirmed cases, you can expect that number to drastically decrease. So if we get to that under 1% figure, then we can expect, between 1 million and 1.5 million deaths.
Okay.
Yeah.
All right,
That's generally so that's where, taking a very zoomed out sort of perspective on it without getting too much into the science, if you apply those different assumptions, you can see how things would work if we had done nothing, if we just existed in a vacuum and we just, had all of our flights on, didn't close any restaurants, didn't tell people to go home, let people who were sick come to work, all that sort of stuff. You can see a worst case type of scenario, but you can see us whittling down on that with all of the various precautions that we're gonna be taking.
Okay.
And also, hopefully we can reduce the number of infections if we can eventually get a vaccine somewhere down the line. But it all goes towards that flattening the curve concept. We need to be sure that we don't have drastic increases of cases at any one time, so we have a health system that's not overburdened with sick individuals. So what that means is the outbreak is going to drag on for a long period of time. So you can expect probably, I would say 12 to 18 months before everything's resolved. Those are the figures that I'm seeing before we sort of reach our herd immunity threshold. So, okay. But that's not even taking into account the fact that if people are susceptible to reinfection, there could be some sort of seasonal component to coronavirus, like we see with the influenza virus, where it's something that we're going to have to address year after year after year. What I will say is that once you develop a vaccine for something, it's typically easier to adapt it and modify it. That's why we're able to so rapidly develop new influenza vaccines every season. But it could be something that we live with for a very long time, potentially with no end.
Yeah. Well, hopefully it just doesn't disrupt our society to the degree that it's currently disrupting it in the future, as more and more people are exposed to it and they become immune to it. We develop a vaccine. Potentially it becomes flu-like where it just, travels and then you get, it undergoes these various sort of metamorphoses, and then you get new viruses and you have to deal with it then. But yeah, it'll be interesting to see how it all plays out. And it's definitely an interesting time to be alive. One more thing that I wanted to ask you before I let you go here is, who would you recommend that people listen to? So we talked about how it's not good information that's coming from this current administration. One news outlet in particular, Fox News, at least in the beginning, appeared to be disseminating what you said was propaganda. So, I don't know how they're doing now, but who would you recommend? I know that through social media and various articles that I've written, or at least one article, I tell people to listen directly to the scientific community, but I was curious as to what your thoughts are on it. Who should people tune into? Just for the facts. Obviously, they don't want the overly technical aspects of studying diseases and whatnot, but just where they can go to get basic good numbers.
Yeah, and that's often the problem with telling people you need to be trusting scientists. Is there's such a delineation between the scientific community and the everyday community. Scientists, you and I, we publish in these journals that are read by other epidemiologists or other physicists and hardly read by anybody else, right?
Yeah.
We don't have a clear mode of dissemination to the public. So oftentimes it's the journalists that are gatekeepers, right? So journalists are the people who will take our conclusions and they'll look at them and they'll boil them down to a line or two and sort of disseminate those in articles to the people. So unfortunately, where we're at now is, I think oftentimes just people in general have to rely on journalists and they have to rely on publications to get to the information that they need. What they need to be sure of is that the popular press that they're looking at are staying true to the sources and they're providing accurate information. So some of the things that I read are the New York Times, the Washington Post, BBC, Al Jazeera. Business Insider's actually posted some awesome stuff on coronavirus. Mm-hmm. But those are popular press articles that you can use. But with coronavirus in particular, there's such a wealth of information coming out of academic institutions. So if you go to Johns Hopkins website, they've got great tools, great information. The same is true at LSU, my institution, Emory. All of these other places are putting out easily accessible, easily readable information that's coming directly from scientists. So something like that, using a trusted institution in public health, is a good way to look for information too. So
I'm assuming the WHO's on that list as well. The WHO has, I'm assuming, a website, a coronavirus website.
Yeah. So
where you can get the basic facts about it, maybe common myths, debunk, things of that nature.
And the thing is, I'm deviating more and more from places like the CDC and the WHO, who on their own are great organizations. They put out great work. They employ fantastic people, the top people in their fields. But the CDC and the WHO are both political organizations at their heart. So I'm not saying that they're putting out information that's false, but I'm saying that you might not get all of the information from those sites. Mm-hmm. So I know, for example, the CDC has taken down the number of tests that they've administered, sort of in an effort to say, the United States isn't so far behind every other country in terms of the amount of tests administered. So that information was taken down. So you'll get accurate information on transmission and how to protect yourself and all of those sorts of things. But don't use that as your sole source of information, because they're not gonna like, they're not going to link you to like the Imperial College article. They're not going to link you to different like academic articles and stuff like that. So the information that you get there will be good, but it might not necessarily be complete, I guess is what I'm trying to say. So don't mistrust them, but
it's important to have multiple sources, right?
Exactly.
Yeah. Okay.
Know that there is more information available to you, and not all of it is going to be presented to you on a site like the CDC or the WHO or something like that.
Okay, I see.
Yeah.
All right. Well, anyway, I just wanted to thank you so much for joining me, Dr. Maloney. It's been really informative. Yeah, congratulations on your recent dissertation defense and all of that. That's gotta feel awesome. So yeah, it was wonderful. Thanks so much for joining us. For those tuning in, until next time.
All right. Thanks for having me. I'll see you guys later.